This is Prime Dimension's demo of our Zika workflow app using CDS hooks. You can see CDS hooks is described here, synchronous web workflow, and launching an app will show that, and invoking CDS services using the patient view. The services are triggered in our case by opening up a patient's record, and those services invoke either CDS cards or CDS decisions, and we're going to show how that works in the live demo. And this workflow is repeated until there's an endpoint achieved with this specific use case. And there's more documentation related to CDS services, and we invoked these or utilized these resources and APIs to create the demo. In addition, we use workflow resources within FHIR, namely the task resource. For the events, we selected the condition and observation resource definitions, and then in addition to that we have the work questionnaire definition, and that's based on various elements you see here for invoking the questionnaire and returning various values, associated responses, and rules. And we've elected to use JSON, and the structure looks like this on the back end of our app, so we've conformed to that standard as well. Now we can proceed to live demo where we have representative patient data. We pull up a patient record, and that checks for date of birth and age. Based on date of birth and age, in this case a woman of childbearing years, we do have in fact a AppLink card that's presented here. And this AppLink card will trigger a tool that can assess this patient for further evaluation associated with exposure and risk of Zika. So we can launch a tool and go into the app. So this leads the clinician through a series of questions related to Zika exposure, that it being the patient's travel to a region. These other questions are somewhat redundant or branch off in a different direction, so we'll answer no right now. And we hit continue, and then it asks if the patient is pregnant. This can come through the EMR if it's already there, but if not, the question must be asked. And if there are any symptoms associated with Zika or symptoms at all, we'll say no, because Zika is often asymptomatic. So now we have treatment advice to test for Zika using an IgM test during the first or second trimesters. We can close this and leave the workflow because that now is preserved in the EMR. So we see that CDS hooks via the EMR, via CDS hooks, and right back to integration with the EMR, this appears until the next event or results are obtained. So we can go back in and get those, input those results. We can pull them from the EMR if they're available, but for our case in this demo, they are not. And we now have a second test to perform to get more details on this patient, and that second test is also represented here as well. And again, this will persist until subsequent steps are completed in the workflow. And any physician can see this with regard to the Karen Lewis. Now we launch the app one more time, and we can input some values that are would indicate most likely a Zika infection or some form of infection that's related to Zika. And with that, we show where we have now an endpoint, a most likely Zika infection, and to give the doctors some guidance on what to do next. What we have shown here is bidirectional EMR integration and workflow automation for clinical decision support, bringing more context to each patient encounter in real time, improving outcomes, and achieving better quality of care, patient experience, and provider expectations.